Welcome to Creative Conversations with CYCJ, a podcast for discussing, debating and questioning justice with children and young people.
Hello and welcome to Creative Conversations episode 17, a podcast series hosted by the Children and Young People's Centre for Justice. In this episode, director Fiona Dyer and Lorraine Gillies are interviewed by CYCJ's Communications and Engagement Advisor Katya Allcott about the findings of the Independent Working Group on Antisocial Behaviour. Professor Fiona Dyer is the director of the CYCJ and was co-chair of the Independent Working Group and has been driving reform in the youth justice sector for a number of years, and in recognition of this was made Professor of Practice earlier this year. Lorraine Gillies co-chaired the working group with Fiona. Lorraine is an independent consultant with a background in leadership across the public and voluntary sector and in developing community and young person initiatives such as Planet Youth Scotland and other initiatives, particularly in West Lothian. In this conversation, they reflect on the experience of chairing the group and what needs to happen next now that the report into the group's findings has been published. Lorraine and Fiona, thank you for joining me today to discuss your work on the Independent Working Group. Lorraine, could you kick us off by talking through how the Independent Working Group was formed and what was driving the need for it?
Certainly can. So it seems like a lifetime ago. Way back, I suppose, 2000, even just as we were coming through COVID. So at that time, I was the Chief Executive Officer of the Scottish Community Safety Network. And some of our membership included the Community Wardens Network and Antisocial Behaviour Officers Forum. We were hearing time and time again that a dialogue on antisocial behaviour was needed. I think it's fair to say that we pressed the government about that and asked them if we could do some consultation work. To ask, some simple questions like what is antisocial behaviour? Is the current legislation fit for purpose? Are the mechanisms that we use the right ones? And the government agreed. The Community Safety Minister at that time was Ash Regan, and she set the SCSN off to do a piece of work. That work came back and said, yes, there's absolutely a need to look at antisocial behaviour. Yeah. And so we were just thinking before we came in, I think that piece of work started in about November 2023.
Yeah.
So a group was put together. We are the Independent Working Group on Antisocial Behaviour. Myself and Fiona. At that time, I was still with the Scottish Community Safety Network. And we were joined by, now let me get this right, Kate Wallace, Victim Support Scotland, Kirsten Urquhart from Young Scot, Tom Halpin, who joined as an independent member, but at that time was with the Scottish Police Authority and had a background in policing.
Leslie McCara from Edinburgh University.
And Lorraine Meek, who was at the time and still is the chair of the Antisocial Behaviour Officers Forum.
Yep.
And works for, oh my goodness, I'm going to get this wrong, one of the West
North
Lanarkshire Council. So we set off back in November 2023 and completed our report in February 2024. 25.
And so we recently held a webinar with Leslie McCara, who's a member of the working group, as you said, and so it was quite timely for us to explore some of the themes and the findings, because some of the current misconceptions about antisocial behaviour and public perceptions of what antisocial behaviour is and who is doing it didn't really tally with what the group heard, Fiona, did it?
As Lorraine said, we worked throughout the whole of 2024 as a working group to really look at and unpick what is antisocial behaviour, what does it mean, what is the public perception of it, and professionals' perception of it. So we engaged with numerous different professionals and working across Scotland, I think over 250, and we had lots of themed sessions, and as the Antisocial Behaviour Group and ourselves, we were out and about. Lorraine and I were at midnight football, we were at two different antisocial behaviour teams in two different local areas. Lorraine did the drive-by with the police and the police car on a Friday night. So we tried to work with a range of individuals. We had sessions with youth justice, we had sessions with adult justice, with retail, with housing providers, Transport, health and mental health, and some different groups from different ethnic backgrounds and LGBTQI+, and to try and get a whole range of views on what was antisocial behaviour. Now, I think there is a public perception that young people create a lot of the antisocial behaviour, and I think that was why I was probably asked to co-chair the group with Lorraine to really look at that. But once we unpicked it and we looked at the data, like Leslie sort of reported on in the webinar, actually a lot of the stats that didn't add up, I think young people it's more visual because they're maybe in central places and hanging about in groups, but a lot of the data was in relation to household disputes and in different areas, and the stats I think were more weighted to that. But I think we lack some of the data we need, which is an issue. But I think when we started unpicking it, there is an issue with antisocial behaviour. People the victims we heard from different victim groups, and Victim Support Scotland also did some work in relation to individuals they're supporting who were affected by antisocial behaviour. So it really is significant, obviously, the impact of this behaviour. But other behaviour we heard about, Lorraine, was criminal. It was a lot of the children was child criminal exploitation when it came to retail, where there is an adult behind this, but the children are actually victims themselves, but they're getting caught up. And some behaviour was criminal. It was quite serious, and we're like, that's not antisocial. So I think there was a real disconnect, and I think what we heard was the legislation in relation to that really isn't fit. It's over 20-year-old. It's really not fit for our purposes in our society today. Would you agree with that?
Totally. On the other side of that, we heard an awful lot about behaviour that was distress behaviour.
Yes.
People behaving in a way because they had some real things going on. They had maybe some trauma. That they weren't managing their finances. So we heard an awful lot about behaviour that was uncomfortable to other people. That would result in a call to Police Scotland.
Yeah.
Sometimes a response, and that response would be an enforcement response, and actually. That wasn't helpful.
There was a lot of mental health, drugs and alcohol misuse, and that was more from adults. It wasn't necessarily from the children and young people that the perception is over. So definitely heard a lot about that, and long waiting times and a lack of resources 100%. When we were out and about. A lot of people, communities, we spoke to a lot of community organisations, and they were saying community resources or community centres not opening back up from COVID, a lot of lack of support. The mental health waiting times have increased since COVID. There's a lot more demand and drug and alcohol services. So it felt that nobody was really the victims weren't getting supported, and the people who were causing the antisocial behaviour, who also needed help and support in a lot of cases, weren't getting the support. So there was just a real challenge, I think we heard, didn't we?
I know, and back to the data, the kind of original question. It's very difficult. If we asked everyone in this room what is antisocial behaviour, we would get 15 different responses. We found it was very difficult to say what is antisocial behaviour. The legislation didn't massively help with that either, which meant that there was real confusion and ambiguity about how much antisocial behaviour there is happening in Scotland, how much that is actual criminal behaviour, how much of that is behaviour that could be attested to other sort of things that were happening. And so we found, so there's a lot of data, but it doesn't really help us, and there are some real data gaps.
And then people don't know who to contact, because is it police when it, if it's low level just disturbance, and then what do you do? How do you address what people are experiencing?
Yeah, absolutely. And I think that it's really interesting the findings were that actually, these are distress behaviours. That these are all symptoms of a
society that isn't supporting people adequately and appropriately.
There's just not enough resources we're hearing. There's just not enough of the right resources. Society's changed, needs change, and I think since COVID especially. So we heard, for example, more people working from home. So there's less tolerance because there's probably noise that people didn't realise when they were at work, potentially. You know, people with washing machines on during the day that was really annoying for others. Floors not being carpeted, or, you know, when people move into houses. So just things like that could be quickly resolved.
Well, I was going to sort of come to that next, in the sense that the group found, Lorraine, didn't it, that antisocial behaviour is preventable.
Oh, yeah.
And so what kinds of preventative measures do you think would have the greatest impact?
So focused on two aspects of it. We really wanted to think about how do we prevent antisocial behaviour, and to do that we had to understand what were the causal factors of that. So we spent quite a bit of time looking at that. But we also were very aware that there are a lot of people that are really struggling with the impacts of antisocial behaviour right now. This work was always about the victims. It was always about really stopping the number of victims of antisocial behaviour and reducing the impact to those who are impacted. So, you know, so we wanted to look at preventative approaches, but we also wanted to think about situational responses. Yeah. What could we do right now? Which is why our recommendations, there are 5 overarching recommendations, but there are like 40 odd actions that we have talked about that sit underneath all those that could be introduced fairly simply. Fiona talked about carpets. Now that's something we come back to time and time again. We heard about people living in flats and lower tolerance to noise for a whole bunch of reasons. But actually very simple things could make a difference. Someone moving into a new house, a new flat, if that flat was carpeted, the difference that would make could be huge. We heard, in terms of the causes of antisocial behaviour, we heard, it doesn't matter who we spoke to, whether it would be transport industry, retail, a cause was a lack of access to services and opportunities. And when we looked around at the landscape in Scotland, we recognised that many services have been withdrawn or reduced. The services that make a difference are youth work, community learning and development, local regeneration activity, and all of those services are the ones that have been withdrawn. So we heard, again, time and time again, about boredom, lack of access, lack of ability to move, lack of ability to take opportunities. So very simply, a reinvestment in some of these services, a real thinking about community and place would make a huge difference.
Because we saw some good examples of like restorative justice, mediation. We looked at contextual safeguarding, about risk out with the family home, and about having safe spaces, especially for children and young people who naturally, when you're a teenager, you congregate in a group. You want to be in a group. So how can you do that safely that's not causing a disturbance for everyone else around you? So there were some really good examples that we heard of, but
we loved the midnight football, didn't we?
Yeah, so we went out with Achieve More Scotland and went to midnight football, and there, you know, and and other community groups working in real areas of need and communities that really need these resources and making such a great difference. But these services fighting for funding, losing funding, other services closing through a lack of funding. So we just heard about a lot of areas that just didn't have a lot for anyone. It's about communities having resources for everyone in the community. Yeah. So it's for children and young people, but it's also for older people. It's for everybody in the community.
I mean, there's two points that are worth making here. So we're talking about reducing antisocial behaviour, but that's not happening on its own. So there are organisations out there trying to reduce addictions, trying to reduce homelessness, trying to reduce the number of young people experiencing care. They're all doing the same thing. Yeah. They're all talking about the same thing. If we manage to get this right and we manage to make that societal shift towards prevention, then we all win. Yeah. And we heard, so we were very clear at the beginning that this was about prevention, but when we talked to people about prevention, we realised that lots of people have lots of different understanding about what that actually means. So we're talking about upstream prevention, the sort of thing that where we do something here and we change the environment or the community or something, and then contextual safeguarding is something that we were particularly interested in. So there are some things out there. We've included a case study around Planet Youth, for example. So Planet Youth is about collecting data from 15-year-olds right now, and then analysing that data, and then the local community working together in a coalition to change the environmental factors for our young people. Now, the 15-year-olds might not experience the change, but the 10-year-olds who are coming through the system will. And they are much less likely to move into criminal behaviour, to offending, to substance misuse.
Too much silo working, wasn't there? Not this preventative approach.
Aye.
And everyone doing their own wee bit.
Aye.
But
So
nobody joining that up.
So you're right. So we all need to think, what is it we need to do to change the environment for people who are experiencing difficulties, and how do we start to look at those risk factors, and how do we start to make that change?
And working in local communities, because they know what they need and what they want, and speaking to people there, and not a decision up here that doesn't suit every community. Because we also spoke to our colleagues and professionals in rural environments, and it is different there. And trying to have an understanding of what is it in the islands, what do they need, because it is different from what central, the four corners of Glasgow needs. So there was a lot of difference. We have engaged with a lot of people, and there isn't one size fits all, but we think there was things that we could do quite quickly or could be done quite quickly that could make a huge difference.
And so one of the recommendations is sort of the creation of the oversight board, and that would be one of their kind of remits, wouldn't it, to kind of look at the best practice and disseminate
Definitely.
that.
I think it needs to happen. So at the moment, we published a report in February, so we're in July, so we're still waiting on a response from the Scottish Government, COSLA and Police Scotland in relation to that. But I think we would see that as being so important, and a group being set up to really look at the report, look at the recommendations, look at what we are saying and all the actions under it, and that would be overseen by this oversight group at this board. So we need that set up as soon as possible. It feels like that could, if we do that, we'll have a bit of momentum going, because these things take time, and it has been already for several months that, and people are still being victims of antisocial behaviour in this time.
It's interesting because, over the summer and since February, we're still seeing antisocial behaviour as being a big ticket issue. People are interested, people are experiencing it, people are suffering from antisocial behaviour. So our recommendations are wider. The bigger sort of 5 are about the overarching group, but it's also about thinking about prevention on a strategic level across all the various realms of the public sector. We also talked about data, needing to have better data. And we also talked about the legislation. We have recommended that we have a full review of our legislation and guidance. And we've also had an ask for our local authorities and our community safety partnerships out there, and that they really think about a strategic approach to their antisocial behaviour that would include prevention. So there's a lot in there, that we feel would make a huge difference. But meanwhile, we're still having conversations, including things like, young people behaving antisocially on public transport. So, it's a live issue. There continue to be discussions about that. There continue to be people experiencing what they can, difficult journeys, if you like, because there's antisocial behaviour on public transport. We have spoken out about under 22's concessionary stuff, saying that we didn't see any evidence that would support that. So whatever happens, it needs to be overseen by a board or a body that understands what our report recommended, and it needs to be evidence-based.
Absolutely, and that comes back to this kind of disconnect between the public perceptions and what's actually happening in the evidence that you saw in your work, and then the further work that this oversight board can do to be really fully evidence-based and look at kind of the best approaches based on that evidence. I think we've kind of covered a lot of the kind of questions I wanted to ask, but I've asked this to both of you. What would really be your biggest kind of takeaway, having looked back at the work that you've done and kind of looking forward? What do you want our listeners to kind of take away from this conversation?
I think for me, it's that antisocial behaviour is preventable, and I think we found that throughout, and there is some real great work going on across Scotland, real pro-social work with all groups, and I think in lots of individuals who are involved in antisocial behaviour, and it really is important that we do prevent future victims of antisocial behaviour and have the right resources at the right time for people in Scotland. And I think it is achievable. I don't think it's not within the realms of what we can achieve, and it could happen quite quickly. A lot of it could happen quite quickly. So I think I'm enthused that but I think we still need a bit of momentum. I think we need the group set up, and I think that we really could make a difference if we all work together. That's my main take.
I think my takeaway is one of frustration. I think that in Scotland we've got the mechanisms, we've got some of the levers. We've had since our report, we've had the public health framework, and we've had the public service review pieces that have been introduced. And in both of those we talk about prevention. We talked about prevention as way back as far as the Christie report in 2011, 2012. And I have been struck by how often we talk about prevention and how much we all want to do something, but I've also been struck about how difficult it is to build a plane when you're flying it. And so my takeaway is that somehow, some way we need to find mechanisms to release some resources so that people can really get their teeth into what needs to happen around prevention. My other takeaway is how important it is to actually involve people in that process. I think that we've seen examples of where approaches, projects, programmes have been developed that actually there's a dearth of actual human involvement in them. So I know that the Scottish Youth Parliament have been talking to Transport Scotland about the under-22 stuff, and I mean that's fantastic. I love watching that, how that dialogue plays out. So those are my takeaways.
Yeah, definitely. Definitely. And I think that's right. The people and the evidence, and I think we don't want to react and make decisions in this country that are not evidence-based. The old legislation criminalised children. It really created new offences for a lot of people, for children, young people, for parents, and instead of criminalising, we need to take a more preventative, a supportive approach, and we've got the evidence there that is more effective. So I think definitely looking at the evidence and speaking to those who are involved, that's the way we need to go forward.
Brilliant. Well, thank you so much for having this conversation with me. I found it so interesting, and we'll be linking to the report in the show notes, and any other resources related to this, such as the webinar that we recently held. So thank you, Fiona and Lorraine.
Thank you. Thanks, Katya.